Hi everybody, Mayer Fertig with the American Committee for Shaare Zedek. I'm with Dr. Roni Eichel in the trauma room at the Shaare Zedek Emergency Department. Dr. Eichel, you are, first of all, thank you for taking time to speak to us. I appreciate it. I know you're busy. You are the, let me see if I get this correct, you're the head of the neurology ICU, neurological ICU, as well as the head of the stroke unit. Is that correct?
That's right.
It's been, what, a year and change now that you've been in operation. You're building out your department down the hall. What's it been like running this now, this new thing at Shaare Zedek that's so important?
I'm about nearly 2 years now actually here, but we are full running it since a little bit more than 1 year, and it's most exciting time I ever had in my life, I think. To develop this whole system here in Shaare Zedek was a major event for this hospital. I think the whole development of stroke treatment not only affected the patients with stroke, but it affected overall all neurological patients coming here to Shaare Zedek. It improved the treatment, the time in which patients are treated, the time in patients going to the CT, going to MRIs. Everybody was involved here, especially the emergency room. The amount of effort this hospital put into this project was amazing, and especially the way that the people here in this hospital worked on this project, was amazing, and the results are more amazing. I couldn't even prognose that this would happen. But today, actually, Shaare Zedek is one of the leading hospitals in Israel in stroke treatment.
In just a year.
Actually, we are today training other hospitals in Israel, in how patients should be treated with stroke, how patients should be triaged with stroke in the beginning, how you should educate your ambulance services in the surrounding area to be connected to you. We worked on this application that is now well established and used not only in our hospital but in a lot of other hospitals in Israel. And this everything in about 1.5 years, it's just amazing.
That is remarkable. I mean, the concept originally, I believe, was that the geography of the area had changed so much that for an ambulance coming from so many places to continue on to the hospital, to Hadassah, just added too much time for a stroke patient.
Yes.
So I guess your concept has been well proven at this point.
Yes, that's true. Because we are very centered, this is a major advantage for the patients that are in the center of Jerusalem to come out, and actually the amount of patients is so big that one hospital, Hadassah, couldn't take anymore this amount of patients, and there was a need, of a major center, for stroke in Jerusalem.
In the central part of
we
the
see
city.
it on the numbers. We treated 1,200 stroke patients last year, and we had 160 procedures. Even for American standards, for the United States standards, we are a high volume center.
Really? When you say a procedure, are you talking about for a hemorrhagic stroke or a
No, we talk about mainly ischemic stroke.
Ischemic.
For intervention by IVTPA, which is a medication that we give through the vein to dissolve the clot, or going to the endovascular suite to do intervention by catheterization.
Right.
But with the neurosurgery department, obviously, we have today the ability to treat also major bleedings and to do the right thing on the right time for these patients, which is important. Everything interacts together. There is not one department that can only stay by itself.
Right. Somebody told me recently about a particularly remarkable story of a young woman who had just given birth, and you discovered, I don't know if you were involved in it personally, a bleed in her brain, and somebody went in through her eye through an optical.
No, not through the eye. This was wrongly stated in the.
We're going to clear this up now.
Yes.
Could you tell us what really happened?
No. So she had a very uncommon event of a bleed in the brain that is due to a vein and an artery that is wrongly evolved, and to stop the bleed and to to prevent further worsening, which would be devastating in her age, obviously, and with that disease. Okay, urgently was a catheterization made, okay, to obstruct the vein, to occlude it actually, okay, which was very successful. This wasn't done through the eye.
It was not.
The problem, the wrong misnomer was that she had a visual problem. Okay, this visual problem was of the bleed, okay, because of the damage in the brain.
Right.
But the catheterization was not done through the eye.
So how was that done?
Actually done through the arteries. Okay.
Very interesting.
Okay, but it was a very uncommon event and was very early diagnosed by us. Okay, and very early treated. So the outcome was very good. Okay?
And she's home with her child.
We
right?
had amazing stories about a woman that was pregnant that had a major stroke that we diagnosed on the spot right away. Which she came in here right away here where we're standing, brought then to the CT urgently, okay, and was then treated with endovascular treatment, and she has no deficits.
Wow.
Which is amazing. She's actually from the States. I have to
Right.
tell you.
Oh, really?
Yes.
This is somebody who was
And
here as
she
a tourist?
No, but she's originated
I see.
from New York, I think.
Yeah.
And she recovered perfectly. This is very uncommon to have a patient in pregnancy with a stroke.
Right.
It's something that I never seen before. It is
Really?
described, but I've never seen such a patient. And I can tell you that we are very satisfied in how the procedures went and how the whole system works here to be able to treat such complicated patients.
Right. Wonderful. Is there anything that, obviously your time is short, but is there anything you'd want people to know about specifically that we haven't covered?
I think today we have to understand that stroke treatment, okay, is making major changes in the last couple of years, and especially even this year, okay, just now in January, we have new guidelines from the American Heart Association, okay, telling us that we can treat stroke even for people in special people that with special problems, okay, even after 4.5 hours. Until we told now that mostly patients until 4.5 hours we can give treatment, maximum until 6 hours or 8 hours. Now we have even evidence that there are some people that we can treat until 16 hours, even until 24 hours.
Really?
Which is a major challenge, obviously, because it means we need to screen much more people, okay, much more people, to exclude or include them in treatments, okay, which is a major effort, okay, for a system. And Shaare Zedek is the hospital now on the front, okay, to develop new triage systems, okay, how we can select the patients faster and more accurate, okay, to decide if they are ready for treatment and if they can be treated, yes or no.
Fascinating. Dr. Roni Eichel is the director of the neurological ICU and of the stroke unit at Shaare Zedek Medical Center. Thank you very much. I really appreciate your time. Take care.
Bye.